So this event is designed to be a starting point for our community to start having a conversation about youth mental health.
Find those easy moments. And if it's a friend that is struggling, right, then talk about feelings, which is the first step, right, to talk about mental health. How are you feeling?
I really would want parents to know that a big part of helping their teenagers is going to be addressing their own mental health, as well as having an open line of communication.
When it comes to mental health, most people feel in over their head, easily overwhelmed. And that's actually quite common for parents to feel that way. And so the take home tonight, what I'm going to express over and over and over again, those parents are not alone.
Good evening, and thank you for joining us. I think, like many of you, we probably have mixed emotions about being here tonight. I wish we didn't have to be here, but I'm glad we are here. I'm glad we're here together. I appreciate what Impact on Education is doing tonight to sponsor this event, to have a community conversation about supporting the mental health of our youth. There's nothing more important. I have the good fortune of managing UnitedHealthcare's health plan in Colorado, and I'm here in that capacity. However, I will say that I think I'm more here as a concerned parent, like Rob was talking about earlier. I have 3 kids who are now in their 20s, but we raised them here in Colorado. They had experiences with the pandemic. They have had experiences with social media, things that I did not experience when I was growing up in the 70s and 80s. It's a very, very different time. So I'm here as a parent, but I'm also here as a student.
My name is Dr. Alana Morales, and I am the principal of Boulder High School. And I am here because I've been in education now for over 25 years. And unfortunately, not only have I had students that I have lost over the years, but as a parent, I have 2 kids of my own, and my oldest had very, very severe mental health issues. And so I have been that parent where you wake up in the middle of the night to go check and see if they're okay. I have had, the crisis calls and the trips to the hospital and all of the above. So I have unfortunately experienced this from a parenting side of things and also an education side of things. And so my purpose in being here is to show support and to help others, because it is really hard and we're all in this together. So thank you for being here tonight.
I'm Maya. I graduated from Boulder High School in 2021. I have struggled with my mental health a lot, as have my peers, and I graduated during the pandemic. So I've been a teenager throughout a lot of global events, as well as a lot of political turmoil. And so I've struggled with my mental health due to personal reasons, as well as a lot of these larger events that have been going on both in the community and in the world.
I'm Chris Uhlig, and I'm a parent at BVSD, and I'm also a suicide loss survivor. We as a family lost our son in 2000, and he was 16 years old, and I'm here to spread the awareness to make sure that mental health is not an issue that gets swept under the carpet or that no one talks about. I'm here to make sure that people start talking about it. Is yours working?
Let's see, is mine working? No? Yes. You think so? Okay, thank you. I'm Kim Nordstrom. I am an emergency psychiatrist. So what is that? That's a physician who works in the emergency departments, helping people when they're having mental health crises. My other job is as the Chief Medical Officer of Rocky Mountain Health Plans, which is a UnitedHealthcare company. But my most important role is that of a mom of a teenager. Why am I here tonight? All right, why am I here tonight? When people see me as their provider, as their doctor, it is on their worst day. And if I can help by being part of this awesome panel. If I can help one family not have to go through this, one family not have to see me in the ED, that's why I'm here tonight.
Thank you. As we transition to the questions here, I'm just going to kind of level set with some kind of alarming stats. First of all, 1 in 6 youth between the ages of 6 and 17 experience a mental health disorder each year, 1 in 6. And half of all mental health conditions start by age 14. It's really amazing how early these issues are starting, and you'd think it's high school, but it's middle school, it's elementary school, and the numbers are alarming.
As I was preparing for tonight, I looked at some literature, and I thought there were 2 particular studies that were relevant to tonight. And there's been a number of studies since COVID about teen mental health, but these 2 in particular, they were surveys that I thought would kind of get our discussion going. One is the State of Student Mental Health, and that was a survey of administrators, teachers, school counselors, and mental health professionals in the school. And 84% either agreed or strongly agreed that teens are much more stressed out than in previous years. The other survey I found was a survey of teenagers. And in that survey, teens said, 70% of teens said that anxiety and depression are the major concerns that affect their peers. Now that way outscored bullying, drug use, teen pregnancy, alcohol use. Those used to rise to the top, and now anxiety and depression are there. Here in Colorado, in 2021, the pandemic had swept through. We were already seeing some trends that as professionals we were really uncomfortable with. We were seeing the rise of mental health issues with our youth from many factors. You may have heard the saying, "It's always darkest before the dawn," and I think that's what we've been in. We've been in this just terribly dark period. But things have happened. There have been improvements. So let's talk a little bit about that. So since 2021, what has happened? Well, I'm sure you've seen on TV that the national government as well as state governments have really freed up funds for mental health and specifically for youth mental health. So parents largely feel that they're alone in this, right? When your kid is suffering, you just want to help. You want to make it better. You want to be able to put that Band-Aid on and make it all better. And when it comes to mental health, you may not have been taught yourself how to have those conversations, how to make it better. And so it's very overwhelming and it's quite isolating. And so the one key of tonight, the theme that you will hear again and again and again, is that it takes the full community to support your youth. You are not alone.
Thank you, Dr. Nordstrom. I appreciate that. Question for Principal Morales. Many parents in our audience have asked what some of the influence on our children's mental health may be. As an educator, what do you see weighing most heavily on students? Social media, bullying, pressure to succeed? What do you see, Dr. Morales?
All of the above is really what I would say, and Dr. Nordstrom really spoke to this. When we were younger, and you think about middle school, since, aptly we're here in a middle school right now, think about the things that stressed you out. It was, what do my friends think? Are they talking about me? Am I going to pass this test? And so those things are still impacting our students today, but it's exponential because now we've added in the anonymous or, with social media and the ability to have conversations with anyone, anywhere, which can be good or bad.
I definitely agree with you with all of that, and I think a big thing about being able to find support, especially from our parents and from our mentors and our teachers, I think a big factor in that is communication, and probably like your guys' generation, understanding that you don't understand to the same extent that we do, especially when it comes to social media. That's kind of just a layer of communication that is going to exist regardless, positive or negative, And your kid is going to interact with it, and you might not know how, and so it's a good conversation to open up, to find out how they're using it, how it's helpful, how it's not helpful, kind of just what's happening. And then when it comes to the pandemic and a lot of recent social events and things happening in the world right now, I think some of the things that have been kind of a negative impact is, I think when you're struggling with how your mental health is being affected by these really large things, and then you're hearing them get politicized, I think that can make it really hard to express that you are struggling with it, because now there's this whole other layer of someone's opinion on the how and the why, but it doesn't change the fact that you might still be struggling with the simple fact that it's happening.
And if I can piggyback off of what you're saying, first of all, I don't know about anybody in the audience, but I would have never said this at this age. Like, it just, what we were aware of at the same age is completely different. And I think, one of the things I've noticed is that as adults, when we look at these new communication tools, we didn't talk to people through Facebook or, T9 texting, parents, how many of you remember that? And it's different now. And as adults, we have to be the ones to understand that it is different for our kids. It doesn't mean their experience has to be like our experience. You can still put boundaries on these things without thinking that they're bad or evil. It's a tool, and a tool can be used for good or evil. And so I do think that's a really, really important point. And when kids are coming through the front office, if it's something that's related to social media, because that's a big topic right now, it's not don't use it, because let's be honest, that's never going to happen. But how do you use it in an appropriate way? That's where the lesson is. So that was a great point.
I'd also say it's important that my generation might understand those sorts of things a little bit better, but I think we're also very overwhelmed and confused a lot of the time. And so that can be good common ground to start a lot of these conversations. Absolutely. Is that your kid is probably also not completely sure of what's happening around them, and so it can be a good place to start talking.
And they think they have to know. That's the part that adds that stress is, they hear all these things because it's everywhere. It's all over the whatever feed it is, whether it's TikTok, Snapchat, whatever. And I wonder if teens feel like they do have to have that figured out, or it's piled on with the academic stress, the social stress, the parental stress, the friend stress. The stressors that our kids are facing now are unprecedented compared to what we faced as kids.
Appreciate that. And amazing wisdom there, Maya. Thank you. Chris, I'd like to come to you. I'm going to kind of piggyback off the pandemic. Maybe you could include some commentary that references that specifically. But the question would be, our state, Colorado, ranks 46 in the nation when looking at the number of children that are flourishing. And Chris, your loss is impactful to all of us. I really appreciate your courage and the mission that you're on to be out and be public about that. Thank you. What advice do you share with other parents on talking to their kids and normalizing conversations about mental health at home?
Well, maybe I start a step back that what we experienced was a little different. So we did not have the child that was actually struggling openly. We had a child that was struggling internally, and no one knew about it. And when I look at that, then it's, you go to the doctor, and the doctor asks you, do you have any history of cancer in your family? Right? But the doctor doesn't ask, do you have any history of mental health in your family, mental health problems in your family? And I think that aspect, if you take that we talked about the schools, but take that into the family, take that into the community. If we overcome the stigma of mental health and basically just openly talk about it, and a way of doing that would be if you have struggles in your family, then you take that and you start talking to your children about it, and you start talking at an earlier age about it. It's a normal thing. We didn't grow up that way, and so it's hard for us to do that. But we need to be doing that for our children, and we need to we need to mentor them in that way, right? So one of the craziest things that I've experienced now is because we are, as a family, my wife and my other two children, one older and one younger, the younger one is not as involved, but the older one is. We're going out there and we're having these conversations. And when we have these conversations, people start to actually come to us and they start to open up. And if I don't talk about it, no one will come to me and actually talk about it and open up. And that is powerful.
And if I could add one thing to what you're saying, our teens, our kids are talking about it. They talk about it amongst themselves.
Some of the things that were most impactful to me as a teenager were having trusted adults both in and outside of my family who were struggling with their mental health, and being able to see them get through like times of crisis and like be medicated or seek help and then keep doing the things that they love and keep working and keep having a life was so important and vital, because it allowed me to really see that even if you're really struggling with something, like there are things on the other side of that and you can like move through that and seek help. And that it's not, like it doesn't have to be shameful and it doesn't have to be a whole thing. And I like that you bring up the like history of cancer kind of stuff, because it's a health issue. It's mental health, physical health, but they're both health issues.
Well, that's a great point. Thank you, Maya. Dr. Nordstrom, I'm going to come back to you. Some parents worry that asking their kids about depression or suicide will put an idea in their heads. Is that a valid concern? You know, at what age should we start talking to our children about mental health?
Well, the first question really is it a valid concern? Is it a reasonable concern that in asking about suicide, do you plant those seeds that then later fulminate into something? In the studies, over and over and over and over again showed that that's not the case. It does not plant a seed. So it may be a reasonable concern, but it is unfounded, okay? So if that takes a little bit of your worry away. The other thing that a couple of the studies showed was that it actually relieved stress from the person who was experiencing suicidal thoughts, because it opened the door to talk about it, because the question was asked. What age? Well, mental health conversations, they don't have to be an event, okay? It's not like the SEX talk, right? That's an event, popcorn, the whole 9 yards, right? That's the most stressful, you know. I think early childhood education has really been forward-thinking in this. In the last 15, 20 years, early childhood education has really worked in terms of teaching children about emotions, learning to put words to emotions so that you're less likely to act out an emotion, not understanding it, going a little deeper. My poor son, again, I have a teenage son. My poor son gets to have a mental health question every day. But that mental health question, I'm not sitting there as the psychiatrist, doing, it's all your mom's fault. No, I don't do that. Well, especially not my fault, right? No, I say, and I'm sure you've never asked your child this, how was your day? Right? That is how you do it. You do it just by coming in. You're coming in obliquely, right? You're not coming head on, you look upset. Now you get to that. How was your day? You don't seem as happy as normal. Is something going on? You don't want to talk about it. Okay, how about we talk about it in 15 minutes? You don't have to talk about it now, but how about we talk about it? Let's set a time to talk about it. And you just keep gently touching on it. So I would just say, my biggest piece of advice is you just keep gently doing it, okay? Don't allow yourself to be shut down, but don't shut it down. Because many times when we want to have those conversations with our teen, it's because we found something right? Am I the only one who's found something? Either a text or something in the room, or whatever. And you may be frustrated. You may have all these of your own emotions going on. So it's important that you check your current mental state. You have your own timeout period before you engage with your child, because the quickest way to shut down the conversation is for you to come in aggressively, because then the child, the teen, will become defensive and game over.
The next question, kind of transitioning off of your point there, Dr. Nordstrom, and I would open this up to anyone. I'm thinking about myself. The importance of parents addressing their own mental health, and just the willingness to be vulnerable, that we all, even though we're the parents and we're supposed to be the rock and the one that look to mom and dad, they must be fearless. And the reality is we're not. But how important is it to address their own, the parents to address their own mental health challenges, to support their children, and really do it in the spirit of transparency and authenticity, and even in the context of, is there something that's hereditary about it?
The first thing I'd say is, anyone flown? Ever been on an airplane? Okay. What did you learn on the airplane? What do you do with the mask? Do you put the mask on the person next to you first? No, right? You're no good to the person next to you if you're not doing okay. So be thinking about it that way, right? It is hard for me to really help others if I'm not in a good place to help others.
I'll pick up on the hereditary, because, again, it was a surprise for us, and we knew a little bit of some history, but very limited. After the fact, so after Johnny's suicide, we found out, the family came to us, and we found out that there were actually a lot more problems in the family than we'd ever known. And and now obviously you look back and you're like, yeah, man, if we would have known, right, maybe we could have had that conversation. But coming from the standpoint where I am now, opening that conversation, digging a little bit in the family, is there anything, right, just like cancer? It helps to then say, oh, I have an opening because my uncle, my aunt, whatever, granddad, someone had a problem, and I can take that to my children and talk to them about it.
What signs, symptoms should a parent or trusted adult be looking for if they suspect a child is at risk?
That's a tough one, because as we've heard, sometimes there aren't signs. And so I think you have to kind of it really comes down to this holistic view of everything. For my personal kid, it was changes in personality, changes in how our interactions, went as, parent to kid, changes in their school, if they're, suddenly having, a lot of trouble at school. And trouble can mean different things for different kids. Some may act out, some may stop talking, some may do really, poorly and stop turning in all their homework, and others may react differently. And so I think from an educational standpoint, it's when you have those dramatic shifts. But I think it goes back to that conversation about having the conversations with your kids, because they may not open up the very first time or the 27th time or the 100th time you ask them, but by them seeing that it's okay to talk about it, and by seeing that you're not giving up, you're going to keep asking, and maybe one day they'll feel comfortable enough.
Dr. Nordstrom, I'm going to switch gears real quickly here. But you mentioned resiliency earlier. So we've got about 5 or 6 minutes to respond to this and maybe make some closing remarks. But I think resiliency is something we really should touch on tonight. So if you'd like to address that, that would be nice.
All right. We could spend an hour, 2 hours, a whole day. We could do a program just on resiliency. But since I rudely wasn't given all that time, Google the 7 C's of resiliency. All right, I'm going to quickly tell you what the 7 C's are, and we could talk about each of them, but I'm just going to highlight a couple of them. I brought my trusty paper because I'm sure I would miss one of the 7. So we have confidence, competence. Competence is communication, being able to self-advocate. Connection, I talked about that earlier. Character, that's core values, sense of self. Contribution, that is a sense of meaning, which then gives you a sense, again, of that connectedness. Coping strategies, how to deal with stress, actually teaching your kiddo. So the big test that's coming up or that big project, actually walking through how to deal with the stress of that by breaking it down into parts or whatever. Kids are able to generalize some of those things as they're dealing with other stress. And then control. Those are your 7 C's. Each of those are kind of inherent pieces of being human. So they all can exist here. And so it's really, as a parent, finding ways to help your child with confidence, to help your child learn how to effectively advocate for self, right? To support healthy connectivity, each of those things. And we really do have a role as parents in that, but so does the community. Anyone else want to talk about resiliency?
Yeah, I would say a huge thing to me is, if you're not creating space for your kid to have emotional conversations and practice these kinds of things in your house, it's going to be happening elsewhere, and the other places it might be happening might have higher stakes for those things. And so if you are providing your kid with that space, then it's practice. And you can think of it literally just like that. You can help them practice these conversations, practice setting boundaries and doing all of these different things. And then when they go out into the world, they're going to be a little bit better equipped.
Brilliant.
Fantastic. It's a great segue to kind of wrapping here. And thank you so much for your insights. Just like to ask each of you for one final encouraging word. Let's finish off with some hope here. So.
First, I would just like to say thank you. I think by being here, you've shown what your commitment is to your kiddos' mental health, and I think that's everything. Know that the schools are committed to helping you as well. And so, if you're worried about having that conversation the wrong way or awkwardly, tell your kid that. They'll still appreciate it. If you say, I don't know if I'm doing this right, but we're going to give it a shot, is better than nothing. So just know, we're a partner in that, and just know that we really do want to support those efforts.
I'd definitely say, going back to the very beginning, emphasizing connection and community, that's kind of going to be the best preventative care, because if your kid has those connections, then they have resources, they have people to talk to, and they have places where they can feel supported, validated, and heard. And a lot of the things that have helped me when I was struggling were having those kinds of spaces.
And open up, right? So those the community, if you just meet and then you talk about, I don't know, how did you do in soccer or so, then that doesn't really help or lead anywhere. But it's taking down the stigma and opening up and saying, hey, mental health is just a topic like any other topic, watching a TV show or whatever. We need to be able to talk about it in the community, amongst peers, teens, in school, in the family, and then outside of the school too, or outside of the school and the family, that daily life, wherever you are. It might be church, it might be something else.
Seeing your kiddo suffer is overwhelming. So put on your mask, take a time out, and engage. If you're leading with curiosity and if you're leading with love, you can't go wrong. Just keep engaging. The community is here to help you. Primary care physician, pediatrician, the school. We have all these organizations in the community that are right there trying to lean in also. So all you have to do is take that first step. Put on your mask, step 1.
Our intention has been to help kind of fuel some conversations, to kind of frame how those conversations can begin, and the importance that we do it is just sort of a regular part of our routine, make it feel natural, be vulnerable, and hopefully that's occurred here in this discussion. Our next panel is going to talk a little bit more about programs and solutions. things that are going on right here in the school system, in your community, and in our healthcare system as well.
I always talk to parents about the push and pull, where our kids will say, no, go away, leave me alone. But in reality, they really don't want us to leave them alone. They want us to hug them, to hold them, to be in their lives. And we just need to consistently be there talking to them and put our phones down and have the real conversations with them.
I hope that folks that are watching or that are attending this conversation and seeing the panelists tonight, if anything, I hope they take away skills or at least something that they can take home tonight to start to have conversations with their young people, whether it's a conversation starter, whether it's checking out a new resource that they didn't know was available to them, or most importantly, reflecting inside and how are you feeling? How are you doing?
I'm Patrick Gordon. I'm the CEO at Rocky Mountain Health Plans. We're part of the UnitedHealthcare enterprise here in Colorado. We serve about 300,000 people in the Medicare, Medicaid, and individual markets. And access to behavioral health, and most specifically, youth access to the services and supports that they need has been a top priority for us as long as I can remember. So I'm going to introduce our second esteemed panel tonight. We're going to talk about what families can do, where they can turn when they need help or they're not sure what to do. We're going to talk about how we can make our systems work better, how we can improve the number of behavioral health providers participating and number of providers who are able and willing and well positioned to support kids at the time they need it most, where they need it most. First with me is Greg McDonald. His preferred pronouns are he and him. He's been a school counselor for 18 years now. And he's currently at the helm of Monarch High's new wellness center. He was sharing with me just before we came on that the center that he's worked to launch at Monarch High School has had over 7,000 encounters since the inception of the school year. That's incredible. We're also joined tonight by Jordan Gatto. Welcome. Her preferred pronouns are she and her. She is the current health and wellness coordinator for Boulder Valley School District, has a passion providing comprehensive physical and behavioral health services to students. We can't separate emotional well-being from physical well-being. We can't separate families from schools and communities. Also on our panel tonight, we've got Darcy Harvey. Darcy's pronouns are she and her. She's a licensed clinical social worker and director of integrated behavioral health with Centura. Again, integration is so important because we need to get services to where people are. She's worked worked for over 25 years in the field, the last 12 of which were at Children's Hospital, providing crisis assessments for youth in the emergency department. We have Anna Kim with us tonight. Anna's pronouns are she and her. She's a board member for NAMI, the National Association on Mental Illness here in Boulder. She's incredibly passionate about providing support, education, and advocacy for families impacted by mental illness and for the ongoing fight against stigma in our culture. Okay, I'm going to go ahead and, I'm missing one of my, I'm going to let you introduce yourself.
Okay, thank you. Hi, everyone. My name is Jenna Clinchard, and I'm the Executive Director for Rise Against Suicide. And I am here tonight because I have a true and deep passion for helping youth that are struggling with their mental health, and specifically when they're struggling with suicidal ideation. I have two kiddos that they both have mental health challenges. I have one that came pretty close, and we had to have a really hard conversation. So when this position came into my life in 2019, I knew that this is where I needed to be.
You know, parents play a vital role in supporting their kids, but they're not the only one. Mm-hmm. Parents can't single-handedly take this on themselves. What role do the rest of us need to play? both within the school and around it, to support parents who are trying to help their kids.
Going through it as a parent and in speaking with parents every day who are seeking help for their kids, I think we have to stop the judgment of each other around our kids' mental health. Everybody has a mental health challenge, and we all talk about that. And I think we have to lift one another up as parents and support one another and realize that we're all in this together. We have to talk about suicide now, even amongst us as parents, and become comfortable with it so we can communicate with our kids. And listen. We have to start listening to one another and learning from one another, because I think that's how we can help our kids heal, and that's how we can learn to take the conversation to them.
Chris said it so eloquently before around stigma. I mean, I was the first generation to openly talk about the mental health issues that faced our family, and we have many, many in our family. I lost 2 brothers to suicide, and it was never talked about. So I think this conversation needs to start happening, and I am so happy that like our generation is talking. And I always tell kids, like, it's awful, the stigma that exists, because it's really, really challenging. But the nice thing about stigma, or the great thing about stigma, is all you have to do is talk about it and it goes away.
And I would add, I think we just need one trusted adult. So if it's a neighbor, a coach, a teacher, a counselor, an aunt and uncle, if there's one place someone has to go that's safe, free of judgment, and someone truly hears and you don't feel alone, right? Because stigma goes away because, it's not just me. And loneliness leads to depression.
Well, I just want to take a moment to pause, because you all are here. Whatever challenges you had to overcome to be here today and to listen, I just wanted to commend everyone who's in the audience. I'm just late today. Because being open and being receptive to the information that we're sharing today is the first step. And our students are crying for us to be listening and to be able to educate ourselves.
Not just the fact that you're here, but when you walk out that door, talk to your family members, talk to your neighbors, talk to your friends. And that's how we spread this message. Because we could do this every night and fill this up, and it's still not enough. We're trying to be there strong for our kids while also dealing with our own things. And then kudos to all of you youth in the background, all of our CU football players. Nice job. And I'm going to challenge all of you back there to be open to talk about, because stereotypically, our athletes, our athletics, we don't talk about this stuff. You've got to be tough. You got to be hard on the field. And we're all dealing with our own stuff. It's not a weakness. So look out for each other. See people on campus. See people in our community. And let's keep talking about this.
My next question is going to go to Jordan. And, the schools are playing a critical role here, really patching resources together, working to build capacity. So, Jordan, what are some of the steps that Boulder Valley has taken to build capacity and access for youth?
I think Maya said it really well earlier. Kids are talking about this. They're learning this stuff in school. They're talking about it with their peers. They're talking about it with trusted adults. This is just second nature for them. And so bringing that curriculum into the schools is one way, but it's really also being able to be the bridge to provide resources for parents, so that way parents can have access to resources themselves, but also for their young people in case they need those. And then also we have many, many amazing, great partners in the community that we also lean on, because it really does take a village. So just as much as you would reach out to them, we would reach out to them too. So we utilize all of it.
Greg, again, you've had an incredible number of students seek services at Monarch. What are some of the concerns they bring up, and how do you suggest that parents or educators, anyone in their day and in their world, respond and support?
First I want to say our kids are amazing. I mean, every day the conversations that I have with them, I overhear, and they are changing the world. I mean, when I was a youth, we would never have thought about doing a walkout to get our voices heard. And we just had that the other day. And that, like, organized by our kids. Yeah. This generation, I feel like we're in good hands. Just the other day, I overheard a bunch of kids talking in our wellness center. So I'm piloting a wellness center at Monarch High School that's been so successful that impact on education is raising funds to have one in each of our high schools, each of our comprehensive high schools, which is huge. And the kids were talking, and one kid was like, I'm feeling so stressed about my test, and I feel stressed all the time. And this other kid goes, hey, I've got a good therapist you should talk to. And they're open to talk about it, which is so amazing. Like, there's not that fear of, oh my God, I'm seeing a therapist. It's, hey, this person really helps me out. They'd be great for you. So asking those questions, looking at the whole perspective of where this is coming from. If things are going on, talking to the school. We can't know everything going on. We need to, you've heard about we're a community. It takes a village to raise a child. We need to have that open line of communication. And I think that's key, that we are all working together. We're not working against each other. We're working together for our kids. And I think that's the biggest thing we need to keep in mind.
Colorado passed a law in 2020 that allows children 12 years and older to sign for their own mental health, which may sound super scary to let your child sign for their own mental health, but letting them know that could save a life, could help them get their own mental health care. And I can pretty much promise if they seek out their own mental health care, ultimately they will come back to you. But letting them know that that's a resource that they can take advantage of if they don't feel like they can talk to you, not because you've done anything wrong, but simply because that's where they're at in their life right now.
And when I talk to parents, there's this push-pull. Like our kids say, leave me alone, I want my space. And they seem to push us away. And the worst thing we can do is just say, okay, you're on your own. Because in other words, they're saying, leave me alone, but I still want you there. It's that push-pull, still give me that hug. And so we've got to remember to keep talking and keep being in their lives, even if they keep pushing us away.
Chris from the previous panel, his wife always says, when you ask your child how they're doing, stop, let them share, and then when they finish, say, tell me more. Just as easy as that. Just tell me more about that. Wow. And those simple words can sometimes just get them to engage with you.
Yeah, that is such wonderful guidance. And really, if you think about it, kids are just starting a lifelong journey in navigating systems, navigating their own emotional well-being and the things they need, and just practicing not making assumptions, maybe recognize that the situation is more complicated than it seems, that you can't always fix everything immediately.
I asked my son's permission to share a story because I got to put my own advice into action last fall. And he reminded me of Chris's story. My son was doing well. He was student of the quarter, elected captain of his hockey team, seemed to be doing really well. And I recognized that there were some scratches on him. We have a really gentle cat, but he said it was the cat that did it. And then I thought, he seems okay, but something feels off. So I sat with him one night while he was drawing, which was great because we didn't have eye contact. Was that from the cat? Yep. Okay. Doesn't look like it was from the cat. It was me. Oh, it was you. Okay. And so I'm like, okay, well, this is different. What do I tell everyone else to do? It was my first experience with this at home. And it led me to be able to ask some questions that were hard to have the answers to. So I was pretty direct. And what brought that on? And have you had thoughts of killing yourself? I have. Okay, so that, and again, like Dr. Nordstrom said, I thought, okay, I'm gonna get myself together, do my thing. It started to hit me emotionally. It's okay for him to see I'm a little sad. I took a break and had some tears to come back and compose myself. But in that story, I asked him permission to share the story, and I said, what did I do that was helpful in that situation? Nothing. That was like, okay, well, good. Maybe I asked a non-op. I said, did I do anything that was helpful? No. Okay, great. That would be great material for me. And then I said, if I wouldn't have asked you, would you have told anyone? No. So I'm going to give myself some credit that I hung in there and asked him. He did say what was helpful is his therapist that we ended up connecting him with. So it was good to give him credit. And my kids sometimes will say, Mom, you're sounding like a therapist. I'd like to talk to Dad. So luckily they have an option in our household to go to one or the other. But when it comes to approaching, I think we've been talking a lot about empathy. The biggest thing with parent-child-teen communication is pausing and listening and not jumping. Our babies are hurting. Our babies are hurting, we want to fix them, right? We want to say, I can make it better, or I'm going to reassure you, you're okay, it's going to be fine. All that does is doesn't validate their feelings. So once we're able to hear them, you don't have to be alone in that, and kind of just getting us back to being normalized. And then letting them know that, and when it comes to offering that help and support, so that my son got some help from a therapist, it's not, you need help for this, but you deserve help. You deserve to feel better.
And sorry, two things I just want to reiterate with what you were saying is some of the best conversations that you can have with your kids are in the car. When you're driving somewhere and you're not having to look at each other, but you're sitting side by side. Or eavesdropping on your kids in the back seat. You get some really interesting stuff. And then the other thing is to not be afraid to ask that question, which is the scariest question in the world. Are you thinking of suicide? My wife and I train signs of suicide, and we train all of our security people and our new staff in Boulder Valley. And that is one of the things we make them all ask a partner, because asking those words are terrifying, because you don't want the answer. But if you ask the question, are you thinking of hurting yourself? Sometimes they're not thinking of hurting themselves. They're just thinking of ending it. And so asking that direct question will get you that direct answer so you can move forward and support them.
And I just want to add one thing too also, because I feel like when you say, your son said you didn't do anything, I hear a lot of parents, especially ones who reach out for help, put a lot of pressure on themselves to have the right answer and say the right thing and do the right thing. And I always like to remind them, like, keep in mind, like, all the things you're not doing wrong. Like, you know, you could be, and that's because you're here. Like, there are a lot of parents who aren't here, who refuse to have this conversation, who would say really hurtful things to their kids if they tried to talk to them, that their kids would say, I would never talk to my parent. And I think it's just really important to remind yourself, like, you're still that person that they know cares, and if they choose to talk to you or something, you're there. So I like to remind parents, because a lot of times in this type of crowd tend to be parents who are putting a lot of pressure on themselves.
Yeah, you cannot do it alone. Remember nothing else tonight. No one can do it alone. I do love that sort of shift of the frame, which is, don't you deserve to feel better? Not you need something, or there's a scarcity or an issue, but don't you deserve to feel better? And that is that's a change. That's a cultural flip we all can lead. But a lot of parents are not in a situation like your families, where you have professional training and years of experience and all sorts of internal dialogue going on. It can be scary, and parents can't go it alone.
Yeah, so there's a really great resource page that Impact put together that I think would be a great place to start. But talking to your school, talking to your primary care doctor, a lot of people skip that step and go straight to, I think my kid needs a therapist. Start with your primary care doctor and your school counselor. The school interventionist can be really helpful as well if there's something more significant going on. And then I just want to say our system is still very fragmented. So we are working, last year Colorado passed a historic number of pieces of legislation to help with mental health, but we're still working on it, and so don't give up. If you have to make 50 phone calls, like, that's the system we have right now. It will get better, but don't give up. Like keep trying, keep reaching out, talk to other parents, talk to each other, and I think you can find something. There is something out there, like Jen is saying, but it might take you a little while to stumble across what's going to work for your family.
And please talk to the schools. I mean, I have students that either meet virtually with their therapist and we can find them a room, or sometimes the therapists come into the schools and we can find them a quiet place to meet. So we will all work with you. Like we said, we're a team for our kids.
And I think that is important to point out. Our therapists are allowed, they're allowed in BVSD schools. So those kids can be met. We're breaking those barriers, right? There's so many barriers to mental health. I'm not sure if you all have noticed that, but there's a lot in the way. And part of our mission is to break that barrier. How do we meet the kids where they're at? Are we going to meet them are our therapists going to meet them at schools? Are they going to meet them in the park? Are they going to meet them wherever, at the ice cream shop, wherever that person feels comfortable, and they're going to be able to hear and get the help that they need?
Yes, actually Colorado right now, we're working on grants for integrated behavioral health being in primary care. Throughout Centura, we're in more than 60 clinics of primary care and women's health. And what that means is when you come to see your doctor and have a complaint, which actually what Chris brought up, we do screen for depression, we screen for anxiety. We're doing that and are encouraging system-wide to be doing that at every visit. Because if it's not asked, we're not going to talk about it. And when we get the question asked, oh, is this something people normally think? And okay, now I can talk about this and I can get some help. So the integrated behavioral health model has licensed therapists right in the office. We're able to see patients sometime at that moment. In a crisis moment, we pop out of our sessions and we see what's going on. How can we help you? We can see you usually within a week to set that up. We take all the insurances that the medical office takes, and this is growing throughout Colorado and actually throughout the United States as a system so that it is whole person care happening within primary care.
So we've got a couple of questions from the audience. These are direct from the audience. And again, these questions are interesting because they're kind of iterations on some of what we already talked about, but it really is a barrier in its own right. So first question from someone in the audience is, what do we ask our kids and how should we respond?
Yeah, I think sometimes asking how you're doing is a good starter, but the more we know, the more questions we know to ask. How did that test go today? I heard prom's coming up. Is so-and-so still dating? I mean, being able to know the details a little bit of their life and recognizing, and what we overhear in the car, we can kind of occasionally pick up on, or if a friend's over for dinner. But I think being able to ask a question beyond, how was your day, how are you feeling, can help them go, number one, oh, she's listening, she cares. And being able to go, yeah, actually it was really hard, or that didn't go well. And what else went well? We do, sometimes at the dinner table, roses and thorns. What was the best part of your day? What was the worst part of your day? And it's become a system. My sister in the audience, I got it from her family. But it's a great way to just kind of capitalize on, this is what went well today, and this is something that didn't go well. And when you start it at that young age, start talking, it's part of our dialogue now.
Can I add, because this is one of my favorite things that happened with my son when he was probably about 15, and I was thinking, okay, I want to talk to him about how he's doing. I said, so how was your day? And he goes, oh, when is this interrogation going to end? And I was like, okay, note to self, he doesn't want that question. But exactly what you're saying, it's like coming at it from a different angle instead of just that straight, how was your day? And he was just, anyway, I still laugh when I think about that, so thought I would share that.
Yeah. Well, in my family, we do what are we grateful for? What are we grateful for today? Just one thing. And even if they may not have that one thing, even if they say something that they're not grateful for, that still can start a conversation. You know where their mind is, right? If they don't want how are you doing? Because I've had that as well.
Because that question has been asked for decades, for centuries, and today it's, I don't know, IDK, IDC, I don't care. Another question from the audience, and this one will go to you, Greg. At different ages, parents, friends, teachers, and coaches can have various influences on children's lives. How do we ensure those are positive?
Yeah, I think the importance of being a role model, and I would say owning our mistakes. means modeling to our youth that we're not perfect. Like, there have been times that hopefully I'm not the only one, but I might get frustrated with my kids, I might snap at them, and then I look at their face and I go, I am sorry, I just had a really bad day today. Did not mean to take it out on you. And seeing the difference that all of a sudden my kids are like, okay, thanks, Dad. Our youth are smart. They can read like our emotions. They know when we're trying to trick them. They know when we're saying something different, but we're not really following it. And just being real with them, being honest, and owning things.
That could be the scariest thing in the world.
It sure can. And saying I'm sorry.
But it's important.
The two hardest words, I think, are to say I'm sorry and mean it.
And I think just saying, I don't know the answer, but let's figure it out together.
Yeah.
So last question for each of you. What's one final encouraging thought you have for our audience tonight? We'll start with you, Jenna.
That continue to connect. Just connect with kindness with your kids and listen. Even though it's so frustrating sometimes, don't give up. Just keep moving forward with them. And baby steps are wins. I took a lot of baby steps as wins. And eventually, they'll talk to you and they'll be present with you.
And I think just it gets better. Like, we tell our kids that, but I think it's true for parents too. I've talked to many parents who've been through horrific journeys and they're in really great places and their loved one their kids are doing well. So there's always hope, no matter how bad it might seem in the moment.
I think it's really important for us to remember that our kids need us, want us, and want us to be proud of them, even though our teenagers have a difficult way of showing it. And like Greg was saying, sometimes it's being pushed away, and that's probably when they maybe need you most. So just making sure when they're little, it's easy. They're called, Mom, watch us, watch us. They still need that, and they still want us to approve it and be proud of them. So just not forgetting that and still being there for them, even though sometimes they're less likable.
This is an incredible generation that's coming up. And they are so strong, and they are so resilient. And just don't forget that. They have a lot of strength, and they will be okay if we're okay. So we have to check in with ourselves.
And we are doing the best we can. Give yourself gratitude, give yourself that forgiveness. If you make a mistake, it's okay. We're doing the best we can.
Some great insight, great conversation. Thank you all so much. Thank you for your work and your leadership and everything you bring to the community every single day. Very much appreciate it. And thank you all.